So today I'll be doing the administering oxygen skill. So first we have to explain different reasons why a patient might need oxygen administered. So this can be anything from like not having enough, not being able to take in enough air for gas exchange, or some other underlying condition, respiratory distress that would cause for oxygen. Anyways, so first we would provide privacy for the patient, and then do hand hygiene, and then introduce ourselves and explain the procedure, and then obviously gather the equipment. Today we will be needing a nasal cannula, a face mask, a non-rebreather mask, and then a venturi mask. So first we'll identify the patient with two identifiers, and then we'll perform our initial respiratory assessment, looking at their perfusion rate and whether or not assessing if they need oxygen or not. First, I'll explain intensive spirometry. So in intensive spirometry, the purpose of it is to really strengthen or maintain existing lung strength, say after surgery, or if you're recovering from a respiratory illness. How IS really works is it's like this little device that you kind of hold upright. Before you put your mouth around it, you're gonna exhale completely. After you exhale completely, place your lips around the intensive spirometry, and then take a slow, deep breath and hold it for a second, and then exhale normally. The stuff that the people who really benefit the most from it, as I was saying earlier, are people who are either recovering from surgery or who had a need for oxygen, say recovering from a respiratory illness. And frequency of use really just depends on the doctor's orders, usually every 1 to 2 hours. The next one we'll talk about is the nasal cannula. So the nasal cannula has a flow rate of 1 to 6 liters with a FiO2 level of 24 to 44%. It's the most commonly used one for people who breathe through their nose. People who breathe through their mouth tend to use the face mask instead of the nasal cannula, and the face mask ranges anywhere from 6 to 10 liters with a 28 to 50% FiO2 level. The next one, the non-rebreather mask, is meant for a little more intense need for oxygen. It goes from 10 to 15 liters or 60 to 80% FiO2. And then the final one, the venturi mask, ranges anywhere from 2 to 15 liters depending on the color of the attachment that attaches to the wall. And this ranges anywhere from 24 to 60% FiO2. Additional oxygen needs. So anyone who is getting oxygen above 4 liters is going to need a humidifier, because after 4 liters the oxygen will dry up your mucosa in your nose, and that can cause uncomfort and even a little bit of damage if it's not humidified. So that's why we would humidify the air that's going. And then a nebulizer is usually used for anyone suffering from a chronic respiratory illness. In addition, older patients and pediatric patients as well, whose lungs are, when they're compromised, may not respond to other therapies as well, and may need a nebulizer for certain medications. And that's it.